So within our power chart, we're looking right into our patient list landing page itself. So as you can see here, we have our patients right in the bottom of our window here. And then up on the top here, we have three different tabs. We have Heritage 1, 2 South Medicine, and then our third floor, which is our Med Surg. So if you're ever looking to customize your list, all you need to do is up in your top left, you have that little wrench icon. Within the Millennium system, if there's ever an icon that you're not familiar with, all you need to do is hover over it. It's called Hover to Discover, and it'll let you know exactly what that icon is. So this is our list maintenance here. And then we have our available list on the left-hand side, and then our active list on the right-hand side. So as you can see here, we have nothing on the available list. If we are looking to create a list, all you need to do is click on that little new button there. This list type will pop up. If we're looking to create just an overall location list, then you will highlight your location, click next. And then within here, all you need to do is drop down your locations folder, and you're gonna be welcomed with a whole bunch of different facilities. You'll go ahead and select the facility that you're working out of, and then you'll drop down the hospital, and then you're going to be able to see all the different areas available within that facility. One quick thing to note is the little nursing cap icon, that's just an inpatient area, and then the little wheelchair just indicates that's an outpatient. So if I want to add, let's say, Heritage 2, all you need to do is check that off, and that's going to select the entire unit. If you want to go even further, you can click on that plus sign and it'll show you all the available rooms. But most of the times you would never need to use that feature. You'll just select the entire unit, and you have the option to also rename it. I'll leave it as is, and I'll click finish. And now it's going to show up on the available list. To quickly note, anything within the available list is not going to populate within your landing page for a patient list. You have to move it into the available list in order to see it. And then let's say if I'm only working within Heritage 1 and Heritage 2, I can remove 2 South and 3rd floor. Once you're ready, you'll click OK, and then now it should only show me Heritage 1 and Heritage 2. And within the patient list itself, it's going to show you pretty much your patient's name, their medical record number, their FIN, age, date of birth, the admitting date, who the admitting physician is, your visit reason, and then whoever their primary care physician is. That's the patient list itself. Now moving on to our second landing page that you'll be using frequently is our provider handoff, which would be accessible through your organizer toolbar up on the top. Within your provider handoff, this is where you'll need to first select the list. So up on your little top left section here, you click on that little drop down. You have your care team list, which we'll quickly go through after. We have our patient list here, and then we have our available list here. So currently, as you can see, it hasn't really reflected on the changes we made. So one quick thing to note is anytime you make any changes, you just always want to make sure you refresh on the top right section here. Once you refresh it, if I go back into our select list and back into our patient list, you should now see that the changes has been reflected. So if I'm going to Heritage 1, now within the landing page itself, you're going to see a bunch of information that is accessible to you. You have your patient column, your location, your diagnoses, primary contact, actions, consult, catheter, restraints, if there are any isolations, discharge, and readmission risk. So these columns can be customizable, or if there are certain ones that you don't need, you could remove it off of this column here or off of this chart. To do that, up in your top right, you have that little 3 lines. That's your page menu. If you click on it, you could go into layout configurations, And this is where now you're able to uncheck some of the stuff that you don't need. So as an example, if I don't need the discharge column, you could go ahead and deselect that. Other things you could also do is you can customize it by dragging and dropping each of these. So if I want to move my isolation right between there, I'll just drop it in there and you'll click apply. As you can see here, my discharge column has disappeared and then my isolation has been moved here. Now, in terms of seeing the patient's information, most of these are all grayed out. The reason being is because we have not established relationships to be within their circle of care. To do that, all you need to do is up on your top right, you have your Establish Relationships button. You'll go ahead and click on that. And then you just check off the ones that you are wanting to establish yourself into. So as an example, let's say if I want to establish myself into PCH Dove. You could go ahead and check that off. And then going all the way back to the top, for this select a relationship, you have consultant physician, covering physician, referring physician, and you'll select the one that you are. So for this instance, I'll just say consultant physician, and I can click submit. And then if I scroll down here, as you can see here, this entire row activates, and now I can see that patient's information, which isn't really showing much. Another thing that you can also do is if you click on the patient's name, it will expand on the right hand side your IPASS. So your illness severity, patient summary, actions, situational awareness planning. And then you also have your clinical data, which will show your vital signs, your labs, medications, intake and outputs. And then the last section we have here is our care team. And then to exit out, all you need to do is click that X button on the top right. And the last thing I want to show you is in our list here is our care team list. So if you're ever looking at a set of care team list, all you need to do is click on that Manage Care Team List button. All you need to do is you select the facility that you're working out of. So for an example, let's say if I'm working at Hotel Dieu, I'll go ahead and select that one. Medical service, if I'm doing specifically, let's say palliative care, and then it will show you numerous different care teams available, and these are all multi-select too. Or if you're looking to just select one, you'll go ahead and select the one, and you'll click Save. And then currently it's still on our patient list. All you need to do is go back into our care team list, and then now it should show within here. And then to set it, just left click on it, and then it will just open up. That's the demonstration for today for our provider handoff, our patient list, and our care teams.